I think when you're first starting to understand the pressing health needs in a community, it's very important to walk around the community in plain clothes, talking to people, identifying who the key stakeholders are in a community, and developing relationships that have an element of trust where people feel comfortable telling you about problems in the community. Also very important to attend community events that don't have anything to do with your research, such as a Christmas tree lighting. One year we actually purchased a Santa Claus suit, organized a toy drive, and we gave those toys to kids in the community. That had nothing to do with our research, but it did demonstrate our commitment to improving community on multiple levels that have nothing to do with our research. Once we developed those trusting relationships, we were able to do an easy street-based survey that really quantified what the health issues were. And that data allowed us to have something to develop funding opportunities, and it also allowed community members to have a voice in what projects got done. And I think that's really, really important to make sure that you're participating in organizing activities that really make the community feel like their voice is important. The relationships that I establish in our target communities have been super beneficial to our research because we are always able to get input from the community about our strategies. Is this the right way to do this? For example, we talked to the community about HIV rapid testing. We wanted to do this project, and at that time I was working with female assistants, and the feedback that we got from the community members was that you need a man. You actually need a man who looks like us and acts like us in order to make this project successful. And that was something that I had not considered. I actually thought, well, maybe females could encourage males to get tested. So getting that sort of direct feedback was very important. Also learning about what services could we provide that aren't research related that would enhance participation in our research projects, so sort of complementary services. So we can provide some free HIV awareness activities. For example, we did conduct a World AIDS Day event in Overtown that had really nothing to do with our research, but it did improve HIV awareness in the community, and it also let people who attended the event know about our research projects, and therefore they had the opportunity to follow up with us, as we did with them, to increase participation. It's very important to always keep in mind that we are learning from community members as much, if not more, than our projects are able to teach them. Speaking with community members, doing qualitative research with key stakeholders, that really teaches us about the barriers to optimal health. And also some of the cultural norms and the attitudes that really limit opportunities to achieve optimal health. So while we can look at survey data and we can look at all kinds of statistics, understanding the barriers that really contribute to health disparities, and these are the psychological barriers, the cultural norms and behaviors, that is something that you can only learn from community members. So I think it is of utmost importance for investigators to really value the education that we get from speaking to community members that really have the ability to enhance our projects and make them acceptable and successful in our target communities.